Hello folks, for the past few weeks we have been learning injections and infusions series related to CPT coding. In that process, I have created multiple videos like part 1, part 2 and part 3, and I have kept all these videos on Fastcoder 21 YouTube channel playlist named as Injections and Infusions Coding. So basically these three videos are related to theory. So in part 4, we will see few live scenarios related to these injections and infusions. So here we will see our first question. So here the question is, how do we report if the patient administered medications at 10 a.m. and also if the patient administers same medication at 10:25 a.m. So this is the question. So in the question, they are asking if we use 96376 for second administration, which is at 10:25 a.m. So here the answer is no. So we can't code 96376 here. Why means if you want to code 96376, the patient needs to be administered the same medication after 30 minutes or starts from 31 minutes. For example, in the same scenario, so initially patient has administered medication at 10 a.m. and if the patient administered the same medication at 10:31 a.m. So we can code that time 96376. If the second time administration is less than 31 minutes, we can't consider it as 96376. So our next question. So here patient has received sodium acetate hydration for 24 hours as well as high dose methotrexate therapy. So during the administration, patient has clearly mentioned start IV hydration after the completion of methotrexate infusion. So here patient has ordered to start IV hydration after methotrexate. So but here patient is not supervising the IV hydration administration. How do we code this scenario? As based on CPT guidelines, if we want to code 96360 as well as 96361, patient needs to supervise the administration. So how do we code without patient's supervision of administration? So basically here our answer is no. So we will not code 96360 as well as 96361 as based on CPT guidelines. The patient needs to supervise the administration. So here patient is ordered. He is not supervising the administration. So here we will not code 96360 as well as 96361 after the complete administration of methotrexate, which is the CPT guideline we need to follow. So this is the CPT guideline basically. So if anyone looking for medical coding jobs in UAE, USA and India, please join in our WhatsApp group. Group link is in the description of this video. So and along with job assistance, we will provide trainings for same day surgery, IPDRG, SCC as well as CCS certification. If anyone looking for jobs or trainings, please send WhatsApp message to 707-526-3939. So our next question is, how do we consider total time if the patient administered twice during the same encounter through the same site? Can we use 96366 or not? So here answer is no. So multiple infusions prepared individually are recognized and reported as individual administrations. So if you want to code it as individually, it needs to be prepared separately. Whenever we want to code multiple infusions, same date of service, we need to select the initial code, which is 96365. Whenever we want to use multiple initial codes, we need to check the documentation whether patient is using same access site or different access site. If the patient uses the different access site, we can code 96365 multiple times. And also in our scenario, patient is administered same medication during the same date of service using the same site. So here we can't use 96365 more than once. Why means here patient is using the same site. So based on CPT, if the patient uses different site, we can code 96365 twice or thrice based on access point. But here in our scenario, patient using the same site. So here we can't use 96365 more than once per session. So here we have an example. So in the observation setting, patient has administered same medication in 3 hours, 3 times in 8 hours interval. So here we need to code 96365 for first 8 hours and 96366 twice for remaining 8 hours. So basically first 8 hours 96365, second 8 hours 96366 and third 8 hour 96366. So here we will not code 96365 twice. Why means or thrice? Because patient has used the same infusion site. So next scenario, what is the appropriate CPT code to report when a patient receives 2 or 3 intramuscular injections? So basically here patient has administered 3 intramuscular injections. Usually we will call it as IMs. So here we need to code 96372, which is the CPT code for intramuscular injections multiple times based on the documentation, and also we need to append 59 modifier to second and subsequent IM injections based on CPT coding guidelines. So for professional services, patient needs to present or patient needs to supervise the IM procedure. So whenever you want to code 96372, these codes are based on injection, not based on components or substance in the single injection. So it's simple. Basically, we will code IMs based on injections, not based on number of medications used in the IM. Most of the time, we will use IMs in ED setting as well as vaccine administrations. So why physician will use IM is they will act very fast. So they will act and they will activate the muscles. So basically IM is intramuscular. So here physician will administer the medication into muscles, not into the veins. So that is the difference between IV infusions as well as IMs. So IV infusion, physician will administer medication into the veins, intravascular. So means inside the vessels. Okay. So IM means intramuscular, means into the muscles. So that is the difference between IV infusion as well as intramuscular injections. So IV infusions will code based on times. Intramuscular or IMs we will code based on number of injections. That is the basic difference. So thank you folks. Please click on like button if you like this session, and also thanks for visiting Fast Coder 21.